Hi, it's Tammy. I was actually asked to talk on autism and how I work with it as opposed to in comparison to the way other professionals do. And I want to lead off by stating that when you meet one person with autism, you've met one person with autism. Now, I don't even like using the phrase autistic because that is a label, and labels limit. It defines what's inside that container, right? And even though being given the diagnosis of autism allows people to get the treatment and the therapy and the educational parameters in place, as well as insurance coverage to cover all the extraordinary cost of assisting these people. It is that's, as far as I'm concerned, where it should stop. When we talk about autism, and I've talked about this in other areas as well, health is on a spectrum. There's no comparing blood pressure between people. There's no comparing diabetes, cancers. How it affects one person is how it affects one person. And the same goes for autism. Yes, there are some similarities when we look at their behaviors. There are the meltdowns. There are moments of stimming, which is a lot of repetitive behavior depending on what serves that child or individual, as well as scripting, which is the repetitive. If you're not familiar with what scripting is, it's the repetitive words saying the same thing over and over again. Oftentimes it could be anything. I'm not going to go and try and define what that looks like. So stimming is repetitive behavior. It could be flapping their hands. It could be spinning in circles. It could be rocking back and forth. It's a repetitive behavior. Scripting is a cycling of words, essentially saying the same thing over and over again. There's other, what I'm going to say as what would be considered unusual behaviors, but then again, every one of us has our quirks. Every one of us has something that disturbs somebody else. And to look at someone living with the diagnosis of autism and claim that they are disabled and inhibited due to these behaviors, you're only hurting not just that person, you're hurting the entire society, because every one of us has something to contribute. And that goes for those with autism. I have met some of the most extraordinary people living with this condition, and they are just amazing. Well, everyone that I encounter is just amazing in their own right. And that doesn't exclude autism. Autism is just a different processing system. That's really what it is. It's an ability to feel and sense the world. It's it's almost like if I was going to use the word disabled in any sense when it comes to autism, it would be that they're thinking, they're overthinking, they're the monkey mind, the way most of us get about. We just think and think and think and think and think. And with autism, they have a tendency to be more impulsive. Yes, that does require guidance. I'm not saying that they're born into this world perfectly and we have everything to learn from them and they've got nothing to learn from us. I disagree with that. As far as I can tell, with regards to autism, it is the exact opposite of what we would consider and label normal people. It's two opposing forces, and when these two worlds come together, the possibilities are extraordinarily endless. Again, those with the diagnosis of autism are incredibly sensitive to the world. I'm even going to throw schizophrenia in there, because I have met some children that were initially diagnosed as with autism and ended up becoming that being switched over to early onset schizophrenia with a co-occurring disorder of autism. Again, even with schizophrenia, you're talking about people who are incredibly sensitive to the world. They feel things. I mean, and I realize, and this is going to really cross some boundaries with a lot of people, because we've been trained to think about it in such a way that it's very difficult to peel our fingers off of that fence and go, wait a minute, this might be something else. You know, when we talk about, when we hear somebody saying, you know, that they're talking, you know, schizophrenia, I really could go into that, and I'm going to leave that for another conversation. What I will say, though, is there's some similarities between the two, and autism is sometimes misdiagnosed, and like I said, the doctors will go back and they subsequently discover that actually what that person's living with is what they would consider early onset schizophrenia. So to sum it up with, in that sense, with autism, is they are very, very sensitive beings. They feel one another. They feel other people. They feel the anger. They feel the animosity. They feel everything. They feel the joy, the exhilaration. They are, they're conduits for every single thing that you could possibly feel as a human being. And when they don't know how to, you know, to curb that, right? And how to actually focus that energy, utilize that energy, dispel what doesn't work for them, and understand and begin to understand the boundaries from where they are as opposed to the rest of the world. These are the things that are possible that we have available for them. It's like those of us who are considered normal, we're given the gift of walls and the ability to create boundaries and almost numb ourselves out to everybody else. And autism is the exact opposite. And so what they really require is a lot of leadership when it comes to being able to define themselves, define how they feel, get in touch with how they feel about something. Do they like something? Do they not like the way that feels? And beginning to distinguish the difference between themselves and other things that they are picking up. This world is there's a lot of people who are empathic in this world who are able to sense. This is not limited to autism. That said, autism is like empathic amplified. You know, it's the empathic on steroids, if you will. They have messages with this sensitivity that it's important for us to pay attention to. They have ways of, you know, showing us. There's things that they can show us. Not to mention the fact they're incredibly intelligent. I was in a talk over the summer, and I made a comment about how intelligent these people are. And I was told in front of a room full of people that I was mistaken. And this is somebody who works with autism. And I was just floored. I mean, speechless is a better way to say it. Everybody, in my opinion, comes to the table with their own particular gifts. And I'm quite frankly fed up with the way we deem some people. We begin to create these hierarchies of who's better and who's not, and it's time to end that, because you know, to coin a phrase, what the world needs now is love. So when it comes to autism, it is really about recognizing their gifts, their intelligent gifts, and more importantly, their sensitivity, and listening to them. I could go on, you know, obviously I could go on and repeat myself, and it's not necessary. I think you understand and get the point. And if not, you're always welcome to certainly engage me in a conversation via email or commenting below. However, I do want to go into a little bit further when it comes to working with autism in a clinical sense. So, you know, number one, recognizing their individuality from a behavioral sense, recognizing the fact that they are entirely unique in and of themselves as individuals, and even for that matter as a culture, because, I mean, they are a form of people that, as far as I'm concerned, are here due to the adaptations that we're seeing on the planet. Their bodies, their brains have adapted in such a way, and even though we're looking at it as bad or problematic, they are actually it's a sign. It's a sign that, number one, that how well the body will adapt in order to preserve the species, and number two, it's a sign it's time for us to begin to revert so much out of all the overthinking and beginning to pay attention to what we're sensing about the world. So again, the individuality is incredibly important, and that does translate into the clinical setting. I know there's an awful lot of ideas on how to work with autism. From the GFCF diet, gluten-free, casein-free diet. There are some clinicians will put these children on antidepressants. Some clinicians will put them on, I've seen high blood pressure medication for the ADHD. They do take ADHD meds. Of course, then there are tons of supplements. I've seen, all kinds of nutritional. I don't want to go into the whole list of nutritionals that I've seen these children on. And oftentimes the behavior normalizes and then it escalates again. So what we're seeing, though, from my angle, is that it works for so long and then it doesn't work, and it doesn't work with everyone. And even though, as these children get older, you still have the stimming, you still have the scripting, you still have the self-harm, and that is, I've seen it as severe as beating the head against the wall and making themselves bleed. So these are the kinds of things that occur and really would benefit from helping them to self-regulate, helping them to find ways to self-soothe. And even though we want to provide for them and we want to give them all the tools that they can have and make sure that their bodies are well equipped, it's for the most part, it's not happening. I see a lot of research. I read an awful lot about this condition, disorder. Remember, disorder is hyphenated, and it means lack of order. I don't consider autism in any stretch of the imagination a disease, although dis-ease is also hyphenated in my world, and that means lack of ease. So when you look at it from that angle, you can see the lack of order and the lack of ease. Now, with all the research that's being done, they've shown differences in, the brain, the structure of the brain. There's a lot of talk about different genetics, but there's no one gene that is the same across the board. Not every brain looks the same. There's variances when they start to go look inside. There is a gene called the FOXP2 gene, which is known for speech and language. It is actually a transcription factor that regulates chemistry further down throughout the sequence of the genetic sequence. And it is also related to brain structure and the brain development, because that's where these chemicals go. Interestingly enough, out of all the species on the planet that has this particular gene, the human species is the only one that's being naturally selected to turn that gene off. And so we're seeing higher numbers of nonverbal people. So, and when you have a transcription factor that begins to, now it's adapted, and which means it's going to throw the chemistry off in that body, and depending on what that body is exposed to environmentally, stress-wise, medication-wise, I really want to emphasize that when you put your children on these medications, not that there's anything wrong with it, but that's going to also alter their epigenome. And therefore, that further offsets the differences between one child with autism versus another child with autism. And the reason why there is no one-size-fits-all approach to autism. Nobody should be putting all of these kids on the same nutritionals. Nobody should be putting all of these kids on the same medications. Even in my own practice, when I start creating blends for these folks, and nobody's getting the same blend because they all are presenting with variances in their behavior. You know, I might have 3 or 4 of them at one time that are all stimming, but there's other things that are happening as well within their system. And depending on how that all shows up, that's going to affect how you address the body with essential oils. However, it is possible, as I've always said, to regulate the neurochemistry to begin to help these children better utilize nutrients and actually produce the neurochemistry that helps them to self-soothe, reducing ADHD, reducing the stimming, reducing the scripting, reducing the self-harm. It is possible. And then in that sense, now that you've been able to calm that down, they can hear what you're telling them. They can be able to take redirection better, have a more expansive diet. There's a lot of play here. And as I said, when we look at autism, it is a sign that the body is adapting. It is also a sign for us to begin to get so much out of our heads and pay attention to the individual. If I had no other message here, it's that. It's really time for us to pay attention to the individual, and that even comes into the clinical setting. I realize as professionals, we are working diligently to provide personal wellness. However, it's really time to pull back a little bit further, because even though we're talking about personalized wellness, I've seen children come in from the very same clinician and they're all taking the same thing. That's not personalized wellness. It may seem personalized in that moment to that parent, but it's not personalized, because from one professional to another, I'm seeing a host of people, coming from one particular doctor or several, they're all, what I'm trying to say is I'm getting children that are all seeing the same physician. And this is across the board. I'm not just working alongside one physician. I'm seeing children and they come to me in kind of groups, and they're coming and they are working with this one particular physician. And even though, like I say, the parent believes that they're getting personalized wellness, personalized treatment for that child, I'm here to tell you that these children are being treated identically, and you can't do that. There is a methylation process. It is different. That is your epigenome. And as I said, if we start from the very beginning and we realize that this FOXP2 gene is adapting, and given the right circumstances in a particular child, and I know there's families with more than one child with autism, in the right circumstances, and it could be coming down from the parents as well. There's slight adaptations within the parents, and then it's being collected on, gathered in the child. And now you have chemistry being improperly, communications, I'm going to say it that way. The communication is misfiring due to the adaptations to that transcription factor. Now you have chemical imbalances coming from that angle. And again, depending on the rest of the genomic sequence, your guess is as good as mine as far as how severe or how mild that case is going to be, and really how to address it. So, I'm hesitating because I'm not trying to not share the type of work that I do. And so but it is difficult to pinpoint specific oils or specific nutrients, because again, every child is different. Now, we do know that autism is prone to, there's a higher incidence of seizures in children with autism or people with autism. So a couple of things along that line. Biotin, which is a B vitamin, is necessary for the body to help prevent seizures. It's used by the brain and nervous system, and it actually works to prevent seizures. So if you're concerned about that, it is a water-soluble vitamin. and it's not going to get toxic to the body. So you are welcome to try and give them to either buy a B complex that includes folate, not folic acid, B6, which is incredibly important, B12, and again, your biotin. But if you get a B complex, generally you get all those in there. But you just want to make sure that it's a food-based folate, not a folic acid synthetic. And again, if you have questions, let me know. And a couple of other things on the area in line with seizures. Lavender, I've said this before, I'm going to say it again. Lavender is a very questionable oil. I know a lot of people like it because it's touted as being relaxing and soothing. And yes, when you have a child with autism, insomnia is a problem. You know, like I said, the overstimulation, the understimulation, the scripting, the meltdowns. I mean, trying to get them to calm down and focus is our main goal as parents. And lavender is not going to get you there. It may do something at the immediate. You may, if you have true lavender, you may actually experience somewhat of a calming effect. But the underlying problems that particular oil can create is significant, because what happens is a lot of times agitation comes from high histamine and which causes high estrogen levels, or high estrogen levels which can cause high histamine. Again, it depends on your family history, what that child is presenting with. But if you're actually dealing with true lavender, it can cause estrogen levels to go up. And then again, now you have the histamine levels to go up, and now you're just exacerbated. So you're going to have bigger blowouts. You're going to have, you know, it'll help in the moment, but then it'll keep recurring. My point to what I do is to not just self-soothe in the moment. And I want you to really hear this. It's not about a remedy to self-soothe in the moment. It's about long-term effects. It's about affecting the body long-term. That I think is really key right here. I never have said that until this point. There is a big difference between the way I practice and the way you would find in most books, or for that matter, the way we are culturally. We are attuned to seeing a symptom and dealing with a symptom. When I work with somebody, I see the symptom or I hear the symptom, I deal with the symptom, but I also pay attention to how the long-term effects are going to be on the body. And so in this case, lavender, even though it might have an immediate calming effect, when it comes to anxiety and stimming and so on, it's not going to, the long-term effects it's actually increasing chemistry that you don't want it to increase. Okay. I feel like I want to keep repeating that because that's so important to remember. So feel free to pause this and think about it. Type me a question. This is a really important thing. The essential oils not only deal with the immediate symptom, they have long-term effects. And it's the long-term effects that my work pays attention to. So now that we've spoken about true lavender, there are other forms of lavender that are less expensive that a lot of companies use in place of true lavender because they're obviously trying to keep their costs down. However, the type of oil that they're using generally isn't, it's a different chemical makeup. And that's another important thing to remember about the essential oils. Just because something is labeled eucalyptus or just because it's labeled lavender doesn't mean that it's actually, they're all the same. There are several different types of eucalyptus. There are several different types of thyme. There are several different types of rosemary, and there's truly several different types of lavender. So it's really important to know what you're getting. And so if you're using a product that has lavender in it, but it's a commercially based and reasonably priced product, my guess is that you're not getting true lavender and that you're getting something else. And the reason why that's problematic is because the something else can have a bad effect. It has a constituent in it that is a neurotoxin that can trigger seizures. So in that regard, lavender is a no-no for autism. That is one one general rule I'm going to put out there altogether. Lavender is to be used with caution with many people. Let's see. I'm trying to think of here. It really depends on what you have going on. If you have excessive stimming, again, it depends whether or not there's enough norepinephrine. Depends on the child's ability to focus, is where I'm going with that. If they're struggling to focus, increasing dopamine levels and helping to bring the norepinephrine into balance is really where that's at. You can do this with oils. Clary sage would be one. Benzoin, otherwise known as styrax, is the other one. Those can be used jointly to have a balancing effect for ADHD. And again, this is no guarantee. I really need to be clear about that. This is something that really is dependent upon your child and what's going on with your child. But if there's concern with ADHD and there's stimming happening, you can use those two particular oils alone and see benefit. Again, if you're in it, if there's been medications being taken, it depends on the medication that was taken, that as far as how that is going to have affected their system. Another one that's really good for serotonin production is bitter orange. Serotonin has its ability, so you give it to them in the beginning of the day, which increases their serotonin levels. Then, of course, you want to help them convert the serotonin to melatonin to be able to sleep. And to be able to do that, you can affect the hypothalamus, which is very important, as well as stimulate SAMe production. No, you don't have to put them on SAMe. You can actually, because it's really hard to get some of these kids to take things and eat different things. So you can stimulate SAMe with holy basil or bay laurel. Those are, both of those contain eugenol, which helps to helps with the conversion of from homocysteine to SAMe, that whole process in there, and the methylation pathway. That said, though, it really depends on whether or not histamine is a problem. So if you were to throw frankincense into that mix, frankincense will now help regulate the hypothalamus as well as inactivate histamine. And another one would be chamomile romaine. So again, how you concoct this is crucial, and I'm happy to guide you. But I need to hear from you specifically about your child. But these are some oils that you can absolutely choose. And again, it's long-term effects as well as making sure that you change it up. You don't want them to stay on these same oils forever. They need to be changed, because as you introduce these oils, as you introduce foods, as they step outside and breathe the air, whether it be in the house or outside the house, the chemistry is constantly changing. So being on top of what's happening with that body and being able to help regulate that body by recognizing all of a sudden there's another symptom, maybe we need to back off on this particular oil for a while. There's nothing wrong with that. It's a dance with the body. And so I'm happy to dance with you until you feel more secure in your moves. So until then, have an absolutely beautiful evening. Thanks. Bye-bye.